What are the kinds of information and data they're looking at, Dr. Labos? What were the considerations they will have before they make any ultimate decision?
I mean, you're basically looking to satisfy some of the basic criteria, which is, are you seeing person-to-person transmission? Are you seeing an increase in cases? And are you seeing an increase in cases in multiple different parts of the world, not confined to just one region? So, I mean, based on that checklist, I mean, yes, the monkeypox outbreak meets all of those criteria. In fact, it's met all of those criteria for quite a while now. Some of the criticism that has been coming out, especially from public health officials in Africa, has been that, this has been a problem for years. We just didn't notice because it wasn't directly affecting us. So this is like the declaration by the WHO isn't going to change anything about the science of the transmission of the virus. It's really just a recognition of the reality that we're currently facing. And I think a bit of a wake-up call that monkeypox was probably something we should have been dealing with years ago. We just let it go on for so long, and now we're seeing the consequence of the fact that we're seeing so many cases internationally in so many countries.
It's interesting, from Dr. Tedros, the head of the WHO, he called it an unusual and concerning outbreak. But at the same time, what we've learned thus far is low mortality. There are vaccines and treatments available. So in that sense, does it even belong in the same category as Zika and Ebola and things like that?
It does, in the sense that one of the reasons why the WHO uses this designation is to allow international cooperation for containment of an illness. And that is required here, because when you're having a disease across multiple country borders, you need international cooperation, because even if we can contain our current outbreaks, and I am still somewhat hopeful that we will, at least here in Canada, contain the current outbreak. We have smallpox vaccines that we can use for this purpose. We still have an issue of monkeypox in Central and Western Africa, where it is endemic, where there are a lot of cases. And so the international community needs to mobilize to get it under control there. We can't just worry about our little corner of the planet. And so part of the reason for this is to generate this type of international cooperation. And so my hope is that once the current acute phase of this outbreak is over, we won't forget about monkeypox. We will continue to deal with it, because if we don't deal with it at its source, we are going to continue to see more outbreaks and more spread, because international travel, of course, is becoming easier and easier.
So in Africa, where it's endemic, it's a different community affected from what we're seeing in the European, Australian, North American outbreaks, and what we've talked about in the past weeks since we first began discussing this at the end of May, is how this is primarily being seen in the community of men who have sex with men. And so right now, there are all sorts of information clinics going on. I noticed a number of them in Toronto this week, vaccination clinics that are opening, Toronto, Ottawa, Montreal, notably. Toronto has a number of them going on this week. And they're taking differing approaches, Dr. Labos. Some are offering shots for pre-exposure. Some are offering shots for post-exposure. Are they different? Is one more beneficial than the other? How does it work?
Well, so both are valid approaches, and both have actually been studied. The reason why you can do what we call post-exposure prophylaxis in this setting is that because if you can get the vaccine to somebody who was exposed, if you can get them the vaccine early enough, they will start making antibodies and be able to fight off the infection. So if you are a high-risk contact, meaning you live with somebody who has monkeypox, you could potentially get exposed, you should get vaccinated. If you did come into contact with somebody and were likely exposed, you can still get vaccinated to sort of preempt the infection from developing. So both are valid strategies, and that's why you're seeing this sort of combo approach of identifying everybody who's high risk, whether they've been exposed or just potentially exposed.
We're also getting a very interesting story out of the UK this week about wastewater coming into play again. Wastewater in London picking up in findings indicating the polio virus. The polio virus.
Yeah.
Now, they're calling for making this a national incident. Apparently, it's low risk to the general public. Yeah. But are we now looking at a resurgence of polio, Dr. Labos?
Well, I certainly hope not. We don't need any other global pandemics affecting us this year, to be frank. I mean, but it just goes to show you how important wastewater testing is, because not every case gets diagnosed, right? Some polio cases are mild and people may not even realize what's happening. What's interesting about this is that the UK does occasionally pick up a polio signal in their wastewater. There haven't been domestic cases of polio in the UK for quite some time because of the vaccination. The vaccination campaign, but you occasionally get international travelers who come to the UK, and so there will be a case, and so they will sometimes pick up traces of the polio virus in wastewater. What's different now is that they've picked up signals of polio over the course of months, so sort of a sustained signal, not just a one-off thing. And so when you're having sustained signals for polio, that would suggest that there's some degree of community spread. What's causing the signals in this case, based on the early reports, is that it's people shedding the virus from the oral polio vaccine. So most polio vaccine, at least the ones that we give here in Canada, are an injection. We haven't used the oral polio vaccine in some time. But the oral polio vaccine, because it has an inactivated virus in it, people can sometimes shed low levels of virus. So they are potentially infectious, which is why we shifted from the oral to the injectable form of the vaccine. But there is a potential risk that if you have the oral polio vaccine and you shed virus in your stool and you don't wash your hands, you could then go and infect unvaccinated people. And because there's about 10 to 15% of the UK population that isn't vaccinated against polio, if you have enough international travelers who are shedding virus, you could potentially cause an outbreak. So I think that's why people are a little bit concerned.